Gaza City is currently experiencing a severe humanitarian crisis, with over 500,000 residents facing famine conditions. The Integrated Food Security Phase Classification (IPC), a global hunger monitor, has officially declared parts of Gaza in famine, marking the first time this designation has been applied outside of Africa. The situation is described as a man-made disaster, with widespread starvation, destitution, and preventable deaths. The famine is a direct result of the ongoing conflict that began in October 2023, when Hamas launched an attack on Israel. In response, Israel imposed a stringent blockade on Gaza, restricting the flow of humanitarian aid, food, and essential supplies. Airstrikes have destroyed critical infrastructure, including bakeries, mills, and food stores, leading to a severe scarcity of essential supplies. This blockade has left residents dependent on external food supplies, as local production has been decimated. The humanitarian situation has been further exacerbated by the destruction of essential services. Approximately 90% of Gaza's population has been displaced, with many seeking refuge in overcrowded shelters made from salvaged materials. These makeshift dwellings offer minimal protection against harsh weather conditions, leading to increased health risks, including respiratory infections and the spread of diseases. The lack of clean water and sanitation facilities has contributed to a rise in waterborne diseases, further straining the already overwhelmed healthcare system. Medical professionals report alarming levels of malnutrition among the population. Hospitals are overwhelmed, with many patients presenting signs of severe malnutrition. Children are particularly vulnerable, with 1 in 6 under the age of 5 now acutely malnourished. The ongoing conflict has also led to the death of over 62,000 Palestinians, with many more suffering from injuries and lack of medical care. International organizations have condemned the situation, calling for immediate action to address the crisis. The United Nations has described the famine as a preventable catastrophe, urging for a ceasefire and the unrestricted flow of humanitarian aid into Gaza. However, efforts to negotiate a ceasefire have so far been unsuccessful, with both sides entrenched in their positions. The international community remains divided on the issue. While some countries and organizations call for increased pressure on Israel to lift the blockade and allow humanitarian aid, others argue that Hamas must be held accountable for its actions and that aid should not be used to support militant activities. This division has hindered coordinated international efforts to address the crisis effectively. As the situation continues to deteriorate, the people of Gaza City face an uncertain future. Without immediate intervention, the famine is expected to spread to other areas, leading to even greater suffering. The international community must act swiftly and decisively to prevent further loss of life and to address the underlying causes of the crisis. In conclusion, the famine in Gaza City is a dire humanitarian crisis that demands urgent attention. It is a stark reminder of the devastating impact of prolonged conflict and the importance of international cooperation in addressing such crises. Immediate action is required to alleviate the suffering of the people of Gaza and to prevent further escalation of the situation.